Hello and welcome. I'm your host, Neil Howard, here on Health Professional Radio. Thank you so much for joining us. In this segment, we're going to have a conversation with Kjersti Grimsrud. She's joining us here as Chief Operating Officer of Infusion Care at Convatec. Convatec is a global medical solutions and technologies company. Kjersti's joining us to discuss the results of a recent survey that revealed a startling gap in care for healthcare professionals, particularly nurses and their patients. Welcome to Health Professional Radio, Kjersti Grimsrud. Thank you so much for joining us this morning.
Thank you for having me. Delighted to be here.
Well, what exactly is your area of expertise and where are you currently practicing?
So I have actually spent most of my career in the in vitro diagnostic space, mostly point of care, so close to the patients. And for the last 4 years, I've been in Convatec and currently in the role of heading over Infusion Care business unit.
Infusion Care, it sounds like transfusions or chemotherapy or maybe dialysis.
No, it's actually, if you think of diabetes and insulin pumps, if you have seen an insulin pump, you would need an infusion set that does the infusion into the body.
Okay.
So that's the biggest part of the business. And then we have non-insulin, where, for example, we have some exciting products coming out for other solutions that is for non-diabetics, but still for chronic patients that need a constant feed of solutions into their body.
Tell us a bit about this survey that was recently supported by Convatec, if you would.
I will. It was actually quite interesting results. So we have lately rebranded Convatec. While doing that, we also wanted to understand more about our patients, their caregivers, and as well as healthcare professionals. What were their needs and how could we position ourselves to help them better? So the survey included responses from 200 patients or their caregivers, as well as 200 nurses in the U.S. And what the research revealed was actually that patients with long-term health conditions, and examples would be living with a stoma or hard-to-heal wound, managing diabetes, which I just mentioned, could also be cancer, they face a lot of stigma. And they have a lot of emotional, physical, and social challenges associated with the health conditions. And what they actually crave is more time with their care teams to feel better supported.
Do nurses in particular, as opposed to the doctors that they serve and the patients that they serve, tend to be more susceptible to these types of stresses and things of that nature in the workplace?
So I think the fact is very often that the nurses are the ones closest to the patient when it comes to following up. For example, after having had a procedure, if you have had a stoma operation, it would be the stoma nurses that follow up with you afterwards. Same with diabetes. Following up with your diabetes nurse is the regular for most diabetes patients. So they would be closest to that care part, and also then very often being the ones directly helping with the emotional part of it.
So why are the results of this particular survey important to those particular types of healthcare professionals?
So the thing is that there is a glaring lack of time to actually be able to help with that care, and a lack of resources, education, and so on and so forth, that the care teams and the nurses would like to have, but they don't have the time or they don't have the resources supporting them.
So it's a matter of raising awareness about this glaring gap in what the healthcare provider wants to do as opposed to what they're allowed to do by the system, correct?
That's correct. And I think we can say, yes, it is important that the healthcare professionals are aware of the care gap. And I think they very much are. They do feel the weight of that. And our thinking is that we as an industry can better help address this issue.
You mentioned as an industry, you're positioned to address this situation. How is Convatec helping to support healthcare providers and their patients when it comes to taking some of the weight and worry off of the patient?
Yeah, so there are different ways of doing that, and we are constantly in development because our industry came from very product-focused industry, but I think we all see now that there's much more we can do. So, for example, we have an educational program, and last year we had more than 300,000 healthcare professionals engaged in our education and training, and we are committed to do more than that. Another example is that we have launched a new nurse solution app, which makes it easier for them to select and recommend the best ostomy products for their patients. This app is also providing the patients with a convenient one-stop shop for their prescriptions, finding advice, and scheduling consultations. So we're taking a step in the direction of helping more.
Now, I also understand that along with this app, you've announced your Forever Caring promise and identity. You said you recently rebranded Convatec, committed to helping bridge this gap between healthcare professionals and their patients. What are some of the other resources, support, and programs that are falling under this Forever Caring promise? So
we are working on a more holistic program. We haven't fully fledged it out yet. So for now, there are several pieces to the puzzle. But just as you said, we, as a company, we have had a long-term focus on innovation that stems from our foundation of combining convalescence and technology, and also a vision of pioneering trusted medical solutions to improve the lives we touch. But the Forever Caring is actually our promise to support healthcare teams, caregivers, and the patients. So with this new promise, we are making a clear commitment to the future.
Is there anything that you'd like to add for our listeners? And then I'll ask you for a web resource where we can learn more about Convatec.
So I think what is important to mention is that every patient who needs care is on a journey. And I think both on the healthcare professional side as well as us in the industry, we all want to be there to help them add a new meaning to the new definition of patient-centric care by both focusing on the physical and the emotional health. www.convatec.com.
Kjersti, I appreciate you joining us here on Health Professional Radio. Lots of great information, and I'm looking forward to speaking with you again one day.
Thank you very much.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Kjersti Grimsrud, Chief Operating Officer of Infusion Care at Convatec. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.